Hello， 大家好，欢迎来看乐山精华资讯网的直播现场，我是主播莉亚。那今天聊的呢是一个很多人都开始默默忍受，但是找不到好的解决方案的问题，那就是视力的中年危机。你是不是呢到45岁之后有这样的烦恼？比如说手机一拿近看起来就很模糊，菜单要拉很远才看得清，或者是你有近视还有老花眼，可以说是左右夹攻，上班要戴一副眼镜，开车还得换另外一副，一整天下来呢最累的不是你的眼睛，而是找眼镜的你。那么问题来了，有没有一种办法在美国如今2025年可以让你不依赖老花镜，可以重新的看清看中距离、远距离和近距离呢？有没有种方式可以让你的眼睛像年轻的时候一样，既能够看得远也能够看得近，还有特别好的视觉质量呢？那今天特别邀请到的是来自这方面的顶尖专家 IQ Laser Vision 北加诊所的 Dr. Jack 田，他是华盛顿大学的临床助理教授，在视力矫正尤其是45岁以上人群老花眼处理方面有着非常丰富的临床经验。我们首先先请 Dr. 田跟我们打个招呼吧。Hi, Dr. Tian. Thank you so much for joining us today.
Hi, Leah. Thanks for having me.
Great. First, could you please briefly introduce yourself?
Sure. I'm Jack Tian. I am a medical doctor. I do eye surgeries. And in particular, I specialize in RLE surgery and premium cataract surgery and ICL surgery.
That's wonderful. So a lot of people actually develop presbyopia around the age of 45. Some people actually suffer from both nearsightedness and presbyopia. So what are their options in 2025?
Great question. 45 is kind of a gray zone. You have a lot of options. If you're nearsighted, in particular, you can do LASIK, you can do ICLs, or you can do RLE. They're all very, very wonderful options, and they'll get you out of glasses for everyday tasks.
Right. So what are the differences? I mean, if there are like three options for me, how do I know which the candidate for?
Great question. Yeah, it all depends on how your lens is inside your eye. So I'll pull up a model here.
Nice.
If this is the eye. There are two places where we can change the optics of the eye so that you can be out of glasses. The first is on the front surface of the eye. And then inside the eye, we can change the lens. Basically remove your natural lens and replace it with an artificial lens, premium lens that'll be able to give you your range, the ability to see distance, intermediate, and up close, everything all at once. So the way you decide, or the way we'll help you decide, is we see what the function of your lens is. At 45, some people, the lens function is not so good. You're already in your bifocal glasses. Even for the nearsighted patient who's wearing glasses full time, they need that bifocal section to see up close. So you'd be a perfect candidate for ICL, RLE. If you want a more permanent solution, you don't want to slowly go blind with cataract later on, then it's probably best to do RLE. But if you want a temporary solution, you can do LASIK or ICL. All good options.
That's wonderful to know. So for people actually in their young age, we usually fully correct our prescription, right? But normally, for people nearly 40 years old, we may use a way called Monovision or blend vision. Could you please just briefly introduce what is the Monovision or blend vision and how does it work?
You bet. Yeah, monovision and blended vision exist on a spectrum. So, the young person, the two eyes are well balanced. You see distance all the way up to close in each of your eyes. But as you age and the lens inside your eye becomes stiffer and unable to focus light as well, then you lose that ability. So that's what we call presbyopia. Then the option that you have is to boost in one of your eyes so that you can use the distance eye for distance and intermediate vision, and then the near eye for intermediate and up close vision. It should be very seamless for almost everybody, as the brain then picks the better seeing of the two eyes depending on what your working distance is. If you're looking in the distance, it's going to pick your dominant eye for that task. If you're reading a novel, then it's going to pick your non-dominant eye, the nearer eye. All very seamless. The brain just knows exactly what to do. So that's how it works.
That sounds really magical. I mean, how can you achieve this? By LASIK and also by RLE or refractive lens exchange. Both ways we can achieve that blurred vision. Is that right?
Correct. Yes. It's all a matter of, if you're nearsighted, you correct one eye fully so that it's distance and intermediate. And then you undercorrect the other eye so that it's intermediate and up close. You can do that in any of those three options: LASIK, RLE, or ICL.
That's wonderful. So you talked about the RLE is like more permanent procedure, and there are like several lens options are available right now actually. So would you please go deeper on that? Like what lens available now to people?
Yeah, great question. We have amazing lenses in the realm of RLE. So RLE, as you know, is basically cataract surgery, but instead of waiting to slowly go blind over the course of 30 years, we just move that surgery up to, age 45 to 55 or so. Then you have the full options of all your parents, grandparents who've had cataract surgery. And nowadays we have basically three types of options. The first, I think, works really well with patients who haven't had prior surgeries, and that's your multifocal lens. This is a lens that's going to give you, in each of your eyes, distance, intermediate, and up close vision. So then the two eyes are well balanced. You're seeing everything all at once, and it's really, really, really good. In some folks who, want to have that extra crisp quality of vision, like a pilot's vision or a sharpshooter's vision, then you want to go to a more customized lens. The light adjustable lens works really well in that realm. You can customize one eye to see really well in distance and intermediate, and then the other eye intermediate and near. So blended vision, as we talked about before. And then we have many, many other options. Again, all of this is dependent on the patient's lifestyle, the patient's own eye and eye health. And so, we have a lot of options to fit all sorts of folks who have, different situations.
That's wonderful, because my mom had the refractive lens exchange last year, and I personally had ICL surgery 3 years ago. I kind of feel like the recovery process is different, probably because of the age or the different type of the procedure. So what is the recovery process like? So usually can people expect to see both clear near and far and distance without glasses in a week?
Oh, yeah, totally. Well, it's surgeon dependent, obviously, but ICL and RLE are very different from LASIK, right? LASIK, we don't have to dilate the eye, so your vision's great like 2 or 3 hours after surgery. ICL and RLE tend to have the same recovery rate. So you're dilated for surgery, it's surgical dilation, so that lasts for about 24 hours. And so by the next morning, you should be back to normal with your distance vision, and then possibly reading by later in the afternoon on the day after surgery. This is going to be very wildly different when you do cataract surgery. I know that might be a little off topic, but if the lens inside your eye is really dense and we have to use a lot of energy to remove that lens, then we're talking maybe more than, just overnight recovery. Maybe we're talking a week of, foggy vision, or even 2 weeks, or even a month. The 90-year-old patient with a really dense cataract, it's going to take a little while longer, obviously. But I would say, our patient population who's, 45 to 75 years old, it's overnight.
Great. So it sounds like when you're like 50 years old, you do like multifocal lens, you're going to get a different recovery process comparing if you have the surgery with 90 years old. I mean, which means with the develop of the cataracts, early because they have the effect. Actually, it's the earlier you have the surgery, it will be better. Is that what you're saying?
In a lot of ways, yes. If you compare RLE surgery in a 45-year-old to cataract surgery in a 95-year-old, well, your chance of having a complication with that 95-year-old is about 1%. Your chance of having a complication with a 45-year-old is probably 0%. The tissues are just so robust. The recovery is much quicker. It's a no-brainer. If you can, have the luxury of doing the surgery earlier, there's really no reason why you wouldn't want to do it sooner than wait to go relatively blind later on in life to do the surgery.
Wow, that's a very good explanation. So in your point of view, what is the best age to have the RLE surgery? I mean, of course, you don't definitely want to have the cataract surgery in 95 years old. You're sacrificing too much time. You're wearing glasses. But are there like a certain point of time that patient needs to develop a certain of the presbyopia then to have the refractive lens exchange, or just to have a little bit of presbyopia is okay to do it? So.
Yeah, great question, Leah. So I think a lot of factors play into this. I think you have to look at how often you're using glasses. I think that's key. So, patients who have presbyopia, and you don't read a whole lot, and you have great distance vision, you're probably not very bothered, and it might be too early to do RLE surgery, But a patient who has great distance vision but spends a lot of time at work on the computer or reading, then it absolutely makes sense. So oftentimes I just say there's a cutoff in your mind. If you're using your glasses more than, let's say, the cutoff for you is like 1 hour and it's a hassle for you, then absolutely RLE is an option, or ICL or LASIK. But if you feel like you can get by fine, it's just you're curious about it, but then I'd say it's absolutely okay to wait. There is no too early.
Got it. So we do have because our audience, they're Chinese people, they live here, and also they have the life in China. So they do compare what's the differences between the surgery here in the US and in China. So when the people considering, hey, wanted to have the surgery in China, what is your opinion on that?
That's a great question. I'm not too familiar with surgery in China. I'm sure their surgeons are very experienced, and they probably have very good technologies. But what I know is in America with our technologies, American lenses, Zeiss, Alcon, Zeiss German, Johnson & Johnson, RX Sight. These lenses are so reliable. We're almost always on target, almost always have happy patients. But again, you have to realize it may not be just dependent on the surgeon, right? Mm-hmm. It's dependent on the technology that's available that can get implanted into your eyes. So what we have currently in America is great, really good contrast, precision. 100% of our multifocal patients are out of glasses for the rest of their lives. And if you can get that result in China, absolutely. If it's cheaper, if it's safe to do there, absolutely. That makes a lot of sense to do it there. Sorry, I just know what we have, which is we offer safety, we offer 100%,
that's
great
good
results.
enough. Yeah. So sounds good. People may want to ask how much does it cost? And when it comes to a lens, actually there are price differences between different lenses, and people just wanted to know why the light adjustable lens is going to cost more than multifocal lens, and are there any differences in lens brands? They may ask sometimes very in detail. What would you say?
Yeah, great question. I think the ballpark number is about $10,000 to $15,000 for RLE. And then the differences are going to be regional. So if you're doing it in LA, it's going to be more expensive. If you do it in Seattle, it's going to be less expensive. And then sort of a spectrum in between. San Francisco, sort of middle of the road. Now, in terms of differences in lenses and cost, well, your multifocal, your extended depth of focus lenses, essentially premium ranged lenses, are going to be cheaper. And that's because they're not adjustable. And so when you add the factor of adjustability into this lens, then after surgery, when we start doing the adjustments over the course of 2 months, well, that's a lot more labor, a lot more goes into that. Mm-hmm. With the adjustable lens, you're really expecting a whole lot more. So you're expecting, 20/15 vision, depending on, the health of your eye. Whereas the multifocal lenses, you're expecting, 20/20 vision, a little better range. So again, it's preference, and the light adjustable lenses are just really, really well tailored to your eye. It usually gets your vision better than you've seen in 20 or 30 years.
That's wonderful. So let's just go over with the patient experience when they walk into the practice, what they're going to experience. Like, is this painful surgery? Do you guys use topical numbing drops, or are you going to use I know there's another way to do the anesthesia called biboba or anything, like make them just fall asleep. Like, how do you usually do that?
That's a great question, Leia. Yeah, no, it's 2025. There are no needles anymore, so it is a very, very, relaxed, friendly, comfortable surgery and environment that you're going to be in. We operate out of an office-based setting, so very high end, very comfortable, very little wait times. We do both eyes on the same day. The sedation is just a little pill that melts in your mouth. You can, we'll get you as relaxed as you want to be. So again, no needles through the arm. That's many almost a decade ago that we used to do that. And then for the anesthesia of the eye, in the past they used to stick a needle all the way back into the eye. Again, we're in 2025. We don't do that anymore. You are going to be so comfortable with just topical drops. So eye drops on the eye, surgical eye drops. And then we numb the eye from the inside as well. So that's called intracameral anesthesia. So those two combined, rarely do we have a patient who feels any pain at all.
Got it. So also people wanted to know, are there any, side effects or risks? Normally, I would just let them know this is the most performant procedure, but still wanted to hear your perspective because you do mention that age means a lot. If you have very dense lens, that just increase more risks. So are there any risk of refractive lens exchange, and do they need to concern about halos, glares after procedure?
Great question. Let's break it down. So let's talk about risk first. So cataract surgery historically has been done in patients, 80 and above, and the historical rate of complications there is about 1%. It's, it all depends on what surgeon you get, right? You can have a really good surgeon who, has a complication 0.1% of the time. And I'd say, that's every surgeon, in refractive basically, and in particular our group. But now we're talking RLE surgery. So if you're asking what's the complication rate for RLE surgery intraoperatively, for me it's 0. So 5,000 surgeries, about 1,500 of those being RLE. Very, very, seldomly will we ever encounter a patient's eye that's hard to work with. And then I think your other question is side
Glares,
effects.
halos, yes.
Oh yeah. Yeah, so halos and side effects, that's more inherent to the lens and the technology in the lens. So, if you are going to do a multifocal lens, well, they have rings designed into them. They are inherently built into the lens. So yes, you will see rings. Definitely you will see rings. So if you have a headlight, and only situationally, right, when you drive at night, that's usually the only situation where you'll see them. So a headlight, if it's about this big, you'll see rings maybe twice the diameter of the headlight. It is a short-lived process. So, the mind will, adapt to this new way of seeing. And over the course of about 9 months to 12 months, it's not a short amount of time, these rings disappear and may fully disappear. But yes, I would say in the first month or so, you will notice them. But with the newest technology lenses, you won't be bothered by them. I would say it would be very rare for you to be bothered by some halos around lights that are almost the same size as the light. Now there are lenses that don't have that, but there's no perfect lens, Leia. And there's always going to be something that's a trade-off for something else. Right. So then, with the light adjustable lenses, then you're dealing with blended vision. You have one eye that's seeing well in the distance, another eye that's seeing well, up close. And for some people, that may throw them off a little bit. There's no perfect lens, but usually any of these options are better than what you currently have. So then we just have to be very upfront about your eye, your situation. I don't like to have patients have surprises after surgery. So we're going to talk, all about your eyes and what we expect to have, after surgery. And I'll go over, or, your surgeon will go over, all the potential pitfalls and what the risks are for each and every side effect.
Definitely. So the whole reason is to increase your life quality, to be honest, and if the halos or glares will happen and will disappear actually after a year, I would say patient already know that before the surgeon. They wouldn't be like surprised. So thank you so much, Dr. Tian, for joining us for this first episode in talking about refractive lens exchange and of course blind vision. How does it work? And thank you so much. Very informative. So 如果大家感兴趣的话，我们都可以让导播老师来放一下我们的这个屏幕上方的二维码，大家可以去扫描屏幕上方的二维码，并且添加微信号 IQ Laser。那 Dr. Jack Tian 呢是美国顶尖眼科医学专家，他同时呢也是华盛顿大学的临床助理教授。如果大家就是只是想找 Jack Tian 医生来做手术的话，是需要去 IQ Laser Vision NorCal 的这个 Center。Also 呢，就是如果你是在 Houston 德州的话 ，Jack Tian 医生呢也有可能会为你做手术。那同时呢 ，IQ Laser Vision 还有一系列其他的顶尖的美国医生，他们在屈光手术这一范围之内呢，平均都是在美国 Top 10这个范围里面的。所以呢，大家呢是在非常好的医生的手里去经历这样的视力矫正手术，希望能够改变你的人生。同时的话，如果有些价格方面的困扰的话，我们提供24个月的免利息的这样的一个分期付款计划。如果算下来的话，未来30年基本上每天只需要花1块钱。在咨询过程当中，您的咨询师呢会为您提供 payment plan 的一些详细的信息。那在下期的话，我们会更加详细的了解到一些美国最新的晶体技术，比如说像刚刚提到的 Light Adjustable Lens， 全球唯一一款能够在术后多次调节晶体度数的这样的一款技术，帮助您达到最理想的视力状态。继续邀请到的是 IQ Laser Vision 北加诊所的 Dr. Jack Tian 来为我们讲解。那以上是今天节目的全部内容了，大家感兴趣可以扫码，并且来添加微信号 IQ Laser。我是主播 Leah， Thank you so much for joining us today.
Thank you, Leah.
Sure. Wait you for next episode. Bye bye.
Bye bye.